So the first thing is you should let your doctor know if you're a smoker. This is not a judgment call. This is something where smoking affects your ability to heal. It affects infection, especially for surgeries like breast reductions and breast lifts, facelifts, tummy tucks. All of those, the blood supply is very important and smoking affects that. Second thing is you should talk about the medications you're on. That lets us know kind of what's going on with your body, and that includes any vitamins and herbals. A lot of herbals and vitamins have an effect on how you heal, effect on bleeding, effect on anesthesia, so it's really important that we know what those are. Then you should let me know if you have any issues with blood clots or bleeding. So blood clots is if you've had a blood clot when you were pregnant, when you're on a long flight, and that's for you or anyone in your family because a blood clot's the biggest risk of surgery. Bleeding issues, if you cut yourself and you have a hard time stopping the bleeding, or if you bruise really easily, those are important things to know. And then the last thing, which I think is probably the biggest thing, is what are your goals and expectations? When you come into my office, I know that you're unhappy with something, and the question is what is that and how can we change it, and what's the amount of price you have to pay for that. Price not meaning cost, but price meaning how much scar, what's the recovery, what are the other things that can happen from doing that surgery. And so the clearer you are about what it is that bothers you is very helpful to me as your surgeon to help you figure out what's the best way to go. Sometimes what may bother other people may not be what bothers you, and the most important thing is to fix what it is that is bugging you.